Welcome to the LaunchFamily Podcast, where we bring expert-backed guidance to real parenting moments. I'm your host, Jessica Shelley, a mom of six, former teacher, and someone who knows how overwhelming it can be when parenting meets the unknown. Today's episode is a powerful one. I'm joined by Dr. Elham Raker, a pediatrician and mom who found herself in an unexpected role reversal when her daughter developed long COVID. What followed was a years-long journey through misdiagnosis, dismissal, and ultimately deep advocacy. Today, we're going to talk about everything that has to do with the medical system when they don't have the answers, how to advocate for your child in the face of uncertainty, and what every parent should know about chronic invisible illnesses in kids. Dr. Raker, thank you so much for being here.
Thank you for having me. I'm excited for our talk.
Yes, yes. Well, can you walk us through a little bit more about, your experience as you were kind of navigating things as a doctor with your own child? But
Yeah.
what did you kind of first start to notice and what unfolded from there?
Yeah. My daughter is now almost 16. This started when she was 12 and a half. Our whole family had gotten COVID during that big Omicron phase where I feel like everybody got sick. And she was sick, not hospitalized, nothing like that, but she had kind of like a bad flu type symptoms. Recovered, went back to school, and it was about 6 weeks later that she had these awful, awful headaches, and that was her initial symptom. At that point, she just had the headaches. We didn't know what was going on. We thought they were bad migraines. n- No idea. She was hospitalized at one point just to see if we could break the headaches. And I remember asking the doctors then, could this be long COVID? And at that point, they just kind of said, maybe, but there's nothing we can do about it. So it was somewhat of an acknowledgement, somewhat of a dismissal, little combo. And we just kind of went about our way. Soon after that, she started to have other symptoms, other organs involved, other systems, brain fog. Her stomach was hurting, constipation. She couldn't sleep. She couldn't think. Um, Everything was just starting to fall apart. She was having chest pain, she was dizzy. So it just after a certain point, I guess because of my medical background, when a child has more than 3 specialists, something's going on. There's something underlying that's probably connecting all of it, right? So it's very rare for 3 different systems or different things to kind of go wrong at one time. And unfortunately, this is one of those illnesses that affects a lot of systems. So you end up seeing a lot of specialists and they don't necessarily talk to each other. And I don't mean they don't talk to each other as if in the sense that they don't consult each other, maybe send each other notes, right? So each doctor knows what's going on, but they're not together in one system, really trying to figure out what's happening. Everyone's dealing in their own silo, and that's just how our medical system is, right? We all kind of go into where we have studied the most and learn about that particular system. So that was just really hard, and that's hard for a disease like long COVID or chronic illness where it really affects so many systems. So my journey actually led me to Facebook. um, so much found on there through other patients and what they had been through. And there are dangers of Facebook, right? I mean, we're all on the mommy groups where people ask all questions and they get all this advice. And I always want to say, talk to your pediatrician. So I think it needs to be taken with a grain of salt, but also patient experience is so important. And having had that and having seeing other people go through it and the symptoms and what they're being diagnosed with was more than I got from any of our doctors. So that led us to going to a clinic that was set up in Denver for kids with long COVID, just because they were getting so many patients, not knowing where to go with them. So they started kind of diagnosing the different things and helping them to kind of find their way back. So that helped us tremendously. We were able to get the different diagnosis, get everything checked out at once, as opposed to, again, going back to our medical system. Had I gone to try to make an appointment with a pulmonologist, a cardiologist, um, to get all the testing done, it would have taken 6 months to a year to accomplish that. And we were able to do it at that clinic in a week. And then the second week, we worked on her plan. So we came back. She started to slowly, slowly, slowly improve, went back to school, was doing okay, not 100%, but okay. And then unfortunately, she got COVID again, about a year and a half ago. And we've now been in this cycle of just pain and fatigue and not really coming out of it this time, unfortunately. So that's our story in a nutshell. Um, and through this journey, I've met a lot of parents, mostly Facebook, but just friends of friends or people have been referred to me or whatever it may be. Um, and my heart breaks for these families. My husband and I are both physicians. We have access to medical care. We're privileged. I get it, right? We're really, really fortunate, and it's been so challenging for us. So knowing what other people must be going through, that they don't have access, that um, so many of these things are not even covered by insurance. If you do have insurance, you have to pay out of pocket for these services. So yeah, I really, especially after a second infection and just being back in this, I really felt called to try to help as much as I could and give a voice to the voiceless.
Absolutely. And you mentioned too, like you're a physician, your husband is a physician. What was it like to kind of navigate through this, knowing that you have that medical background too? I mean, for
Yeah,
that maybe average parent who's not doesn't have a medical background, right? What kind of advice would you give for those parents?
I gotta say, first of all, if there are any parents listening that have kids with chronic illness, I commend you. And I feel like sometimes I learn medical things from them, right? Because they get so involved in so much learning about what's happening in the latest research and all the things that it really is quite impressive how much they learn. But um, what we, yeah, I really don't think it was our medical background. Our medical background, like I said, gave us maybe a little bit more access to other physicians and allowed us to talk to people, but it didn't give us that much more. Unfortunately, we're so lacking in research in this arena, especially in kids, that even if you find a doctor willing to prescribe, which is great, you don't know what to prescribe necessarily. You don't know what's going to help. So we've been fortunate in that sense where we've been able to try different things and get different things, but um ultimately we need to get more research to figure out what are the things that will help.
I mean, with long COVID too, and other chronic and invisible illnesses in kids, why do you think that that's so often overlooked? Or, as you mentioned, like operating in silos may have something to do with that. But what else is going on?
Well, one, it's a new-ish illness, specifically long COVID, not some of the things that we've seen because of it. So, just to name a few, because I know people see this on social media a lot, like POTS, postural orthostatic tachycardic syndrome. POTS is much easier to say. Dysautonomia, which is a part of POTS, the autonomic nervous system, heart rate, blood pressure, digestive, sleeping, those things don't work anymore. So those are affected. Pain, which we don't totally understand why it's happening. Fatigue, right? So these are kind of the more common symptoms. And there was even a recent article describing different symptoms in different age groups. So anywhere from 6 months to 18 years and how different age groups will present differently. So I think one issue is that these symptoms are very vague. Um, there is no, right? I mean, any pediatrician who sees an otherwise healthy child come in with these symptoms will assume that there's something going on at home, there's something going on at school, it's anxiety related, which I get. I really, really do, having been on that side of it. You're gonna, ask about social history, what's going on. So that's kind of the first thing, because that's the vague type of symptomatology, right? That's how it presents. Um, the other thing with long COVID is that in the beginning we were testing, right? Which sometimes you caught, sometimes you didn't, but now no one's testing for COVID. So you could have a mild cold, right? Your kids like you just did.
Yeah.
Like it just ran through your family.
Yeah.
Um, and 6 weeks later, 4 weeks later, 2 months later, whatever it may be, your kid has a headache. You're like, oh, okay. And you may not put that together. And your doctor's not going to put that together, right? So now it's just like, oh, well, my kid has a headache or a stomach ache, or, so then you go down that path and you're not even thinking about that infection that happened in relation to this. So those are kind of the main things. I think in school, a lot of these kids, especially the younger kids, will just say, I don't want to go to school. So then you just think it's school refusal, which is a symptom of long COVID, because they don't know what else to say. They don't know how else to express what's happening, right? These are very hard symptoms to explain in adults, even, let alone a child. So I think it's a lack of awareness. Doctors don't really know that long COVID's happening. Sometimes not at all, honestly. Some doctors don't know about it at all. They don't know about it in kids. We've been told that it's rare. We've been told that kids don't really get long COVID or don't get sick from COVID. And in actuality, long COVID, the numbers are about 6 million kids in the US alone. So that makes it the number one chronic illness in children, beating asthma. So there's a lot of myths around it, and I think part of that is breaking those myths and trying to get the word out to parents, to doctors, to really be on the lookout when you have these vague symptoms. Um, It could be a lot of things, right? I'm not saying it has to be long COVID, but long COVID should be on the differential diagnosis, right? The things that we consider in that. The other thing that makes it extremely difficult is once you consider that, now what? Because there is no testing for it. There's no way to prove it, right? So it's what we call a diagnosis of exclusion. So you've looked at everything else that could be going on, and then you think that may be what's happening. And again, it doesn't matter because there is no approved treatment. And I'm sorry, I don't want to say it doesn't matter. I misspoke. It does matter. It's important to name it, to diagnose it, to know what it is. But then we're again in this dilemma of like, okay, well, how do we treat it? Which there is treatments, more symptom based treatments, right? Treating each thing that may be coming up. Um, so I don't want to say there's no point. There is. It's important to name it, it's important to acknowledge it, it's important to know that's what's happening. It's certainly important for people in government, for schools, for those people to know what it is, to understand that these kids are getting it, are getting sick, that we have to do something about it.
Yeah, one of the things that you mentioned was, connecting the dots to from home of like, oh yeah, 2 months down the line, if my child gets a headache, oh, maybe that could be related to the cold we had 2 months ago. So what are some other like signs that parents can be watching for when it comes to, okay, well, maybe there's something more beyond just like the headache or just beyond the cold or like what
Yeah,
actionable tips to take
I
away?
know, and it's so hard. Honestly, I think parents are going to be the best judge of this because they're just going to feel like something's off, right? So, like for my daughter, it was the day, extreme headaches that never went away. It could be pain, it could be stomach ache, headache, joint pain, um, just generalized body aches. It could be, like I said, refusal to go to school that there wasn't before, or it could be like ADHD-like symptoms, so brain fog, forgetfulness, um, problems with memory, problems learning, problems reading, right? So a lot of these kids are just like, think that they're having like a learning disorder or something. Again, something's happening at home, causing them to not want to learn, or, but that's not the case. It could even just be anxiety or depression that, again, maybe they had before, but it wasn't severe, it wasn't noticeable. And we know that it's not just anxiety, depression causing symptoms, or um, anxiety and depression because of what's going on. I mean, there certainly is. Mental health is complicated, but there is evidence that there's anxiety because of what's happening. So our vagus nerve, is our rest and digest nerve. And we know that's being affected in long COVID. So if your vagus nerve isn't working, right, and you're always in this fight flight mode, that's naturally going to make you feel anxious. So there is pathophysiology there, right? And just saying, oh, they're just anxious, right? That's not really the whole picture. And of course, if you are sick and you're bedbound and you can't get out and you're not doing life, then yeah, that could make you more depressed. So there's it's a lot of different things with mental health connected to it, but there definitely is a direct correlation with the COVID infection and how it's affecting our mental health.
Wow. I mean, something that I didn't even like necessarily make sense of like the anxiety could also just be related to everything else that's going on physically, right?
Mhm.
With your body, like that kind of connection. One of the things that you had mentioned was, the kind of struggles that you had with getting your daughter the diagnosis and going and traveling to Denver. Once you actually got that diagnosis, what did advocacy then look like? Now that you have the diagnosis, then what happened? Especially like when it came to like your daughter's school or navigating what is this transition point?
Yeah.
Other caregivers on that.
So I think for school, there was definitely like pacing is a big part of this illness, and trying to slowly get back to whatever baseline that you may get back to. So we had to advocate for a child to be able to go back to school in a stepwise fashion, which wasn't something they normally did, but we had to get approval for that. Um, and then I would say, uh, I would highly, highly recommend getting an individualized education plan versus a 504, depending on the severity. But these kids need a lot of accommodations. And there's also just at different times, different accommodations are needed. So my daughter started full-time school and then she had to go to hybrid school. We're hoping she can go back to so we needed to have all those things in place so that we can activate it at any point. Um, there's definitely data out there about what accommodations should be in there, but it's a lot of the basic ones, like, needing extra time on tests, needing um, extra time to finish assignments, excused absences, those kinds of things. Um, and it's a lot of education. It's these kids, and just going back to a previous question to tie it up about why are these kids being ignored? They show up and they look great. We had a doctor say to us after going through in my medical terminology of all the things wrong, right? Like we would present complicated patients by systems um, in residency and medical school, right? That's how you do it in the hospital, like neurology and cardiology. And so I was doing that. I was presenting my daughter. And at the very end, she says to me, "Oh, well, she looks great." And it was just the most dismissive comment that someone could make after going through explaining all that. Like she looked awful to me, honestly. She was just in one of her like sad, depressed kind of, I'm in pain. You could see it on her face, you know? Um, and I know this doctor meant it in like a good way, like, oh, well, she looks okay, so that's a good thing. But it just came off really dismissive. So, as doctors, I think we need to be aware of how we're saying things as well, not just what we're doing or what we can offer, but those moments that we have with our patients can make a big difference. And in school, it's making teachers understand that, yeah, she may show up and look good, right? Like she's there, there's no physical ailments that you can see, but you have no idea what's going on in their heads and how hard it is for them to focus, or she has a headache. She always has a headache, you know? There's baseline pain that she's just dealing with when she's there. And they don't see her when she's at her absolute best or when these kids are at their absolute best because they're home in bed. So that's the other problem with, that when you rightly refer to it as the invisible illness is knowing no one sees it. And I don't know. I try. I think that's a part of my advocacy is trying to get people to see these kids, even though they don't see them at the worst, to try to understand it. But I think it's hard to really get it.
Yeah. Well, what would you tell parents that are like listening in today, about how they can stay firm and what they know, even if they're
Yeah.
having a doctor that's dismissing them, or maybe they're navigating some challenges with the school? Like, what do we need to know to kind of?
Yeah. Stay strong, advocate, don't give up. If you have a doctor that's really not willing to listen or is being dismissive, it might just be better to find a different doctor. I don't know if you're going to change their approach or their opinion. And I don't mean this negative to doctors. I am a doctor. I've been on both sides of this. It's very, very challenging in our current medical system, especially pediatricians. We have 10-minute visits allotted. It's beyond ridiculous. Um, Doctors are burnt out. They're exhausted. They're doing their best. So I don't mean this negative towards any physician. I know deep down every physician is doing their best. Nobody goes into medicine not wanting to help their patients, right? Like I know that. But I also know there's a limit. And I know that some of these doctors are just completely um, lost with how to handle a patient that is that complicated. Hopefully, my hope is the doctors will say something like, I get it. This is a lot. There's a lot going on. I don't think I'm the right physician for you right now. Let me help you find someone that is, or something along those lines, right? So we're not gaslighting our patients. We're validating what's going on for them, but maybe we're not able to do it in these short visits that are standard of care right now. So I would say don't give up, right? Find the person. Um, Go to your Facebook groups. I know it sounds weird. And I don't get medical advice from Facebook. I'm not saying that, but just the lived experience of other people can be so helpful in these situations. Um, Mommy groups, I'm looking for a doctor that has more time, that has different focus. Um, a lot of long COVID patients have dysautonomia, as I mentioned, and there is Dysautonomia International is a website that you can go to. You can look up each state, each city, what doctors are recommended. So that might be a good place to start to see if there's a doctor on that list. Again, it might not be exactly what you need, but it's something to help with someone that's more familiar with what may be going on. So it's challenging, right? It's really challenging, and you're exhausted. Your kid's sick. You don't know what's going on, and you have to become mama bear and advocate for your child. It's just there is no choice right now. There is no other option. If you're lucky enough to live in a state that has like a long COVID clinic, that's great. But even beyond long COVID, just any time that you feel like your child is something's going on, just keep going. Trust your instincts and keep going. Not, again, not to say that those doctors are bad or they don't know what they're doing. They're not the right doctor for you. Not the right doctor, not the right time. Just, so um, that's what I would say. And then at school, same thing, advocate, advocate, advocate. I know in some cases people have referred to lawyers or gotten help from the law. There was just that Supreme Court case that passed regarding kids getting assistance in school and that their rights to get that, which is great. So the law is on your side, right? Even if the school isn't always. And it's a lot of advocacy. So it's really just staying strong in what you know to be true, right? Like, I'm sure better than anyone, Jessica, with 6 kids, that mama gut feeling, like, and no one can take that away from you, and no one knows your kids better than you. So stay strong in that.
Yeah. I love that. I mean, I feel like we could wrap up the episode right there without just being
Yeah,
really leaning into that. And I'm not sure if I've shared this on another episode, but when my second son was born, he was like 4 months old or so, and he was diagnosed with failure to thrive. And at the time I was a classroom teacher, and I remember like we had been going to the doctor for like every weight checks like every 3 days or something like that. And I got this call at dismissal as I was putting other kids on the bus to go home to their families. And they're like, you need to come to the children's hospital immediately, like tonight. You're going to be here. We're going to run all these tests. And then we ended up being there for like 3 weeks. And I had a 1 year old at home at the time too. And so my husband and I are like trying to figure out what's going on. It was a teaching hospital. So when they would come in to like do rounds and like update us on everything, there was like 15, 20 people in the room. And I'm
yeah.
just sitting there like, I'm a teacher. I don't even like, what does that mean? What
What's
is this
going on?
word? Can
Yeah,
you repeat this
yeah,
again? Because I have no idea. And it can feel so isolating too, of feeling like I'm the only one who's ever lived this situation. And so I turned to the Facebook groups as well, just like, okay, even just for my own peace of mind of like knowing like, okay, their child is, 5 steps ahead of where my
right.
child currently is. There's hope for whatever we're going through. Um, but also, like, he's fine now. Like, he was on a feeding tube and we had to like learn all of that stuff. And, that was part of our journey and our story. But, now he's a thriving 8 year old and super active and he can eat everything. And we're like, okay, praise the Lord that, he's
Yeah,
healed. He's on this journey. But also at the same time, I concur with like the medical advice thing. Like some of the things that I see in there, I'm like, I'm not sure if that would be a great
yeah.
solution. So, what do you,
I still think we need to check with a doctor, and hopefully you can find one that you trust, that you can say, hey, I saw this, or I learned about this, or what do you think about this supplement? And again, it's finding a doctor that's willing to be open to those things, to listen to you when you say those things, to not be dismissive, and to let you know safely if it's okay to try. Because there's a lot of supplements also, right? I mean, my daughter's on quite a few, unfortunately. Um, and you could get really bogged down with it. So it's also just having someone, as a physician, I always checked with her doctors before we changed anything or added anything or took anything, just to kind of make sure, right? So even as a physician, I think we need to get the experts on board. Yeah, but I think it's a good place to just learn about things, potentially find support. I mean, I've definitely found a few mom friends that we keep in touch, and just the support part of it, right? That's so important too. So, like you said, just the community. Um, so yeah, I think it's just finding the good and, ignoring the bad.
for sure, for sure. I think there's good and bad with all of those, sort of, avenues to getting, ideas
Yeah.
in. There's forums that are endless as well that you could find,
Yep, yep,
online.
yep,
So,
yep, yeah, and any of those, same kind of concept is finding that community and, yeah, yeah, and not letting it drive you crazy, right? Like, looking for the hopeful stories, looking for the ones, because other thing that ends up happening is people that stay in those Facebook groups are the ones that are struggling. Once they're better and they're doing well, they don't come back and say, "Hey, we're all good," right? So it's also not losing hope, I think, when you're in those groups of like, "Oh, everyone's so sick." But staying hopeful that, like you guys did, that there is a light, that things will get better, just kind of hang in there.
Yeah, absolutely. What a great resource too. Like the internet has done so many things and
Yeah.
allowing us to connect with people we ordinarily wouldn't have been able to. But before we wrap up, so at Launch Family, we have an AI assistant parenting coach. Her name is Emmy, and we really designed her to help parents navigate through like those tough questions of like, okay, what is the next step, or what are some things that I should consider when it comes to child development, how to navigate those conversations requesting an IEP, which is an individualized education plan, as you mentioned. Like, how
Yeah,
do I
that's great.
actually do this? So, while we have a real expert with us, I'd love to get your take on a couple of these questions that were written in by families.
Yep.
The first one is, my doctor says everything looks normal, but I know something's wrong. So, what now?
Yeah. Um, that is so hard. Again, I would ask for a second opinion. I mean, this particular question is vague, but it goes back to just what I was saying. If you know something's wrong, then go with your gut. I just, again, having been on both sides, I had an experience in the ER where I was a resident, so it wasn't my final call, but it always sits with me that there was a patient that came back a couple nights in a row, and we sent him home. And he ended up um, being deceased within that time frame. And I'll never forget that. And I'm glad it was kind of early on in my career. If a mom is concerned, take her concerns seriously. There's just something about that. Now, if a patient comes to me, a mom comes to me, and they're really concerned about XYZ, and I feel really comfortable saying, I don't think that's what's going on. I think it's this, and I think we can do this. Then, we can always watchful wait, right? We can always say, let's see how things go in the next week or two, depending on what's happening, and go from there, right? But you're not just dismissing that concern and telling them to go away. You're still keeping a watchful eye. So there are times where, yeah, I could read something on the internet and freak out. That happens to me too, right? And I need someone to bring me down and calm me down. So there is two sides of that coin, where as a doctor we have to also know, like, okay, now I really don't think this is what's going on. Really need to just help you calm down. But I think it's that dismissive part, right? Like just not being dismissive of the concerns versus, I don't think this is what's going on, but let's keep an eye on it. Or here's some testing we can do, or the tests are all normal, but let's think about whatever else. If that's not your situation, if you don't think you can wait, and if this doctor is being dismissive, then I would look for another doctor.
I think this next question is actually really related to that first question, which is, where can I go for real answers when my pediatrician shrugs off my concerns? So I guess like, what are those next steps if your primary care doesn't
Yeah.
out?
If it's a specialty area, so if it's like I'm having chest pain, my kid's having headaches, my kid's having stomach ache, I would go to that specialist of whatever system you're most worried about. Um, Hopefully, if nothing else, they can offer you more testing, they can look into more things and figure out what's happening. Um, if we are thinking like the long COVID or long whatever, right, a post-viral thing, which is becoming more common, then I would try to keep that in mind also and bring it up, because sometimes your doctors won't think about it, but at least if you bring it up as a possibility, they might have more direction of what things to look for, because there is now quite a few diagnoses related to long COVID and testing available to at least help assist with what may be going on. So that could be something to bring up. Otherwise, if it's just like a system, right? So one presenting symptom, I would ask for a referral to that doctor and be very adamant about the referral.
Super helpful, like the advocacy mama bear sort of
Yeah, yeah,
feeling.
just
Yeah,
like, "No, I really want to see a specialist." At some point, they're going to have to give you that referral or go to a different doctor, you know? Yeah, like I said, as long as the doctor's not being dismissive, if they're saying, "Okay, I get that this is what you're really worried about, or I get you think something's wrong, and this is what I'm thinking, and this is my next steps. Let's see how things go." I think that's very valid. But if they're just saying no and just not even listening to what you're saying, then I think it's time for another opinion.
Well, any other lasting thoughts for listeners today?
Um, no, I think the advocacy part, like you mentioned, being, the mama bear to your kids, knowing that long COVID and other long COVID related illnesses are on the rise. So if you notice your kids are s- off or something's going on that wasn't there before, um, don't just chalk it up to, them being on social media or them being um, lazy or, I think those are my main concerns is where parents, especially influenced by family members, right? Like, oh, your kid's just spoiled. Oh, your kid's just privileged. Oh, your kid. Those kinds of things. Because we actually got that a little bit with my daughter when we didn't really have a diagnosis and she was just in her room a lot. She wouldn't come out. She was up all night. And she just turned 13. So it was like, oh, she's just being a teenager, right? So I'd say don't do that. Believe your kids, believe in what's going on and keep fighting for them.
Oh, well, thank you so much for sharing your story and just general strength with us today. The journey that you've walked as both a doctor and a mom and voice is one that so many families really need to hear. To our listeners, if your child is facing symptoms that no one seems to understand, you're not alone. Trust your gut, keep asking questions, and seek support. In the show notes, you'll find links to the long COVID resources, advocacy groups, and ways to connect with Dr. Raker as well. Until next time, your instincts matter, your voice matters, and your child's health is worth fighting for.